Palliative. A patient diagnosed with atrial fibrillation is prescribed Warfarin. Which of the following can interact with the effects of Warfarin? Select the correct answer choice. A. Dark green leafy vegetables. B. Carrots. C. Furosemide. D. Ferrous sulfate. The correct answer is A. Dark green leafy vegetables. Dark green leafy vegetables are high in vitamin K and will reduce the effects of warfarin. However, the patient should maintain a consistent intake of vitamin K to prevent increased or decreased effects of warfarin due to changes in diet. Ferrous sulfate, iron, does not interact with warfarin. Furosemide does not interact with warfarin. Carrots are high in vitamin A, which does not have an effect on warfarin. The nurse reviews a handwritten order for morphine for a pediatric patient. The order is written as follows: MS-04 .25 milligrams IV Q8 hours. According to safe medication practices, which of the following is the correct way to write this order? Select the correct answer choice. A. MS-04 0.250 milligrams IV Q8 hours. B. Morphine sulfate 0.25 milligrams IV Q8 hours. C. MS-04 0.25 milligrams IV Q8 hours. D. Morphine sulfate 0.25 milligrams IV Q8 hours. The correct answer choice is D. Morphine sulfate 0.25 milligrams IV Q8 hours. The correct way to write this order is to write out morphine sulfate and to include a 0 in front of the decimal. MS-04 is not an approved abbreviation for morphine sulfate, as it can be confused with magnesium sulfate, which is a different medication. The other error is that drug dosages of amounts less than 1 should have a preceding 0 before the decimal so that the decimal point is not missed, which could cause a dose 10 or even 100 times higher than intended. This mistake could lead to severe adverse consequences, up to and including death. Additionally, drug orders for amounts less than 1 should not have a trailing 0, as this could also lead to massive overdosing if the decimal point is missed. The nurse is caring for a patient with metastatic pancreatic cancer. What is the best way for the nurse to manage the patient's pain? Select the correct answer choice. A. Provide a non-stimulating environment. B. Administer pain medication as needed. C. Administer pain medication on a routine basis. D. Administer pain medication without the patient knowing. The correct answer choice is C. The nurse should administer pain medication routinely. Administering pain medication on a routine or scheduled basis is superior to a PRN or as-needed basis. As-needed medication administration often leaves pain untreated. Never administer pain medication to a patient without their knowledge, unless the patient is sedated or unconscious and shows physical signs of pain, such as tachycardia, hypertension, and hyperventilation. A patient is prescribed Enoxaparin after a prostatectomy for the prevention of deep venous thrombosis. The nurse monitors the patient for which common adverse reaction. Select the correct answer choice. A. Soreness at the injection site. B. Hives. C. Bleeding. D. Anaphylaxis. The correct answer choice is C. Bleeding. Enoxaparin is an anticoagulant similar to heparin. The most common adverse reaction is bleeding. While soreness at the injection site may be present, it is not a priority. Hives and anaphylaxis are not associated with enoxaparin. A patient with osteosarcoma states her pain is 9 out of 10. The physician writes the following order before leaving to see another patient. The order reads MSO4, 4 milligrams IV, 1 dose stat for breakthrough pain. What should the nurse do next? Select the correct answer choice. A. Ask the charge nurse to verify the drug order. B. Assess and document the patient's vital signs. C. Call the physician to clarify the order. D. Prepare to administer 4 milligrams of morphine sulfate. The correct answer choice is C. Call the physician to clarify the order. The nurse should call the physician to clarify the order. MSO4, MGSO4, and MS are all on the Joint Commission's unofficial Do Not Use abbreviation list. They can be easily confused with one another and are not acceptable abbreviations. The requirement is that the physician write out morphine sulfate. The physician needs to clarify and make a new order. Other unapproved abbreviations include IU for international units, U for a unit, QD and QOD or any version of it, and trailing zeros or lack of leading zeros. Do not ask the charge nurse to confirm the medication order. Remember, as the nurse, you are responsible for giving the drug. It is your license on the line. If you want to ask an authority, call the pharmacist, who would be able to confirm that this is an unapproved abbreviation. The nurse should not prepare to give morphine sulfate until the order is clarified and rewritten. Assessing and documenting the patient's vital signs should be done regularly, but the nurse prioritizes clarifying the order so that the patient's pain can be medicated. Once the medication is given, the respiratory rate and other vitals should be monitored. A patient with severe rheumatoid arthritis is prescribed methylprednisolone to control inflammation. The nurse is creating a teaching plan to include common side effects of long-term corticosteroid use. Which of the following should be included? Select all that apply. A. Skin atrophy. B. Poor wound healing. C. Osteoporosis. D. Hypotension. E. Peptic ulcer disease. F. Hyperglycemia/diabetes mellitus. The correct answer choices are A. Skin atrophy. B. Poor wound healing. C. Osteoporosis. E. Peptic ulcer disease. And F. Hyperglycemia. Corticosteroids have a number of negative effects on the body's ability to heal and repair. Corticosteroid use can cause skin atrophy and thinning, poor wound healing, muscle atrophy, obesity, hyperglycemia or even diabetes mellitus, osteoporosis, peptic ulcer disease, hypertension, not hypotension, and cataracts. Corticosteroids can also cause adrenal insufficiency, Cushing's syndrome, and hypokalemia. If used long-term, corticosteroids should not be stopped abruptly, but slowly tapered down. This prevents complications from suppression of the pituitary adrenal axis. A patient has been taking a beta blocker for 2 years and receives regular checkups to monitor its effectiveness. The nurse would expect to find what if drug tolerance develops? Select the correct answer choice. A. Increased urination. B. Weight loss. C. Gradual elevation in blood pressure. D. Gradual decrease in blood pressure. The correct answer choice is C. Gradual elevation in blood pressure. Beta blockers lower blood pressure by inhibiting neurotransmitters from binding with beta adrenergic receptors in the heart. A gradual rise in blood pressure would occur if the patient builds tolerance and the medication is no longer as effective. A gradual decrease in blood pressure would not signal tolerance to a beta blocker, as decreasing blood pressure is the desired effect. Weight loss should be encouraged in overweight or obese patients with hypertension, as this can also help decrease blood pressure. A healthy lifestyle should be encouraged, whether or not medication is required to treat hypertension. Increased urination is not an indication of tolerance to a beta blocker, nor is it a side effect. However, it could signal an underlying medical condition that may need further evaluation, such as UTI or diabetes. A patient taking bisacodyl asks the nurse how the medication works. The nurse knows that bisacodyl. Select all that apply. A. Is bulk producing. B. Reduces stool surface tension. C. Is an osmotic laxative. D. Stimulates the myenteric plexus. E. Increases fluid and electrolyte secretion. The correct answer choices are D. Stimulates the myenteric plexus, and E. Increases fluid and electrolyte secretion. Bisacodyl is a stimulant laxative that acts on the myenteric plexus to stimulate colonic mass movements. Bisacodyl is also a contact laxative, increasing fluid and electrolyte secretion to facilitate evacuation. Bisacodyl is not osmotic It does not reduce stool surface tension, nor is it bulk forming. A patient tells the nurse he takes antacids after every meal. What should the nurse teach the patient regarding antacid administration? Select all that apply. A. May be taken 4 times per day or more as needed. B. May be taken at bedtime. C. Do not take antacids within 2 hours of other medication. D. Take antacids before meals. E. Do not take more than once daily. F. Do not take at bedtime. The correct answer choices are: A. May be taken 4 times a day or more as needed. B. May be taken at bedtime. And C. Do not take antacids within 2 hours of other medication. Antacids may affect the absorption of other drugs and should be separated by at least 2 hours. Antacids should be taken 1 to 3 hours after meals and at bedtime as needed. Antacids can be taken 4 times per day or more. A patient is prescribed Labetalol for hypertension. The patient discontinued taking the medication due to side effects. Which of the following patient statements most probably describes the reason for non-compliance? Select the correct answer choice. A. I can't have sex. B. I can't fall asleep. C. I become confused. D. I get agitated. The correct answer choice is A. I can't have sex. Labetalol is a beta and alpha blocker that inhibits the release of epinephrine and norepinephrine. The result is hypotension, which can lead to sexual dysfunction and impotence. Other common side effects of labetalol are dizziness, headache, edema, dyspnea, nausea or vomiting, and fatigue. Insomnia, confusion, and agitation are not common side effects of labetalol. The physician has ordered atropine for the treatment of symptomatic bradycardia. The nurse should question this order in which of the following patient conditions? Select all that apply. A. Prostatic hypertrophy. B. Glaucoma. C. Left-sided heart failure. D. Diarrhea. E. Otitis media. F. Pyloric stenosis. The correct answer choices are A. Prostatic hypertrophy, B. Glaucoma, and F. Pyloric stenosis. Atropine is an anticholinergic medication and is contraindicated in patients with angle closure glaucoma because it will increase optic pressure. Atropine is contraindicated in patients with pyloric stenosis due to the increased risk for complete obstruction. Atropine is contraindicated in patients with prostatic hypertrophy due to the increased risk of urinary retention associated with anticholinergic medications.